Thank you so much for coming out today. This was planned in less than a week's time, and there's no way to know how many people are here. I'm not going to make an estimate, but there's quite a few of you who apparently care enough to say enough is enough, and that's incredibly important, so thank you very much. Well, this week started with a couple emails. I said this was just promoted about 1 week ago. It started on Wednesday. And how many of you, raise your hand if you manned an exit with a protest? Wow. That's about half this crowd stood along the I-275 loop, passing out information, many of which was handed out today, the people that were walking by, to talk about what we consider an infringement of liberty. Something that quite definitionally would change everything that we know about our economy, everything that we know about the American way of life. It's a bill that's currently in the Senate and will eventually make its way over to the House. And we wanted to make sure that Congressman Steve Driehaus, which is in the building, not in the building right now, but in that building, right over there that you were surrounding, say there is enough of us on this moment's notice that care, that will hold you accountable. They're going to say, not on my watch. This is not going to happen on my watch. While we don't know every single bit of the language of these bills currently, we do know that some of the language that's there would absolutely destroy what we know about small businesses with penalties. They're talking about imposing penalties on small businesses. Mandating healthcare coverage is something else that's potentially out there. We don't know what's going to happen with that either. And then I think many of you, and I've seen a lot of signs that talk about the actual price tag of this. Something that is being thrown out is about $1 trillion. Now, we don't know what that $1 trillion will come from because there's no way to know the unintended consequences. So I'm not going to talk a lot about the money. I'd like to just apply a very simple principle that I've been writing about lately, and that is healthcare is not necessarily a right. It's not in and of itself a right to have healthcare. Things that are rights are things that you are born with, and the law cannot take away from you. You cannot lose rights. Rights are liberty. It's the ability to pursue happiness. This is what our founders talked about. They talked about those things in terms of rights. Healthcare didn't always look as we know it today. It wasn't always employer-based. There's a number of problems that have sprung out, and a lot of them come from what the government has regulated the system. A lot of this has come from the government creating a problem that didn't previously exist a great number of years ago. And now what we're seeing is that we have not just President Obama, but a very, very progressive movement coming in and saying, well, the key is that government's going to fix this all for you, so don't worry about it yourselves. Government will go ahead and take care of this fix. My question to government is, can you please name something that you've done well in the last 100 years? We'll give them that. If I can recall that Jimmy Carter, he may have invited the idea in that we're going to rid ourselves of dependence on energy and the government's going to do it, so we're going to create the Department of Energy. That worked out really well for us. It's doing great. It's amazing. And you know what? Let's just go ahead and create the Department of Education because our schools aren't good enough and we're going to increase test scores and the government needs to get involved in this because we're really good at that too, so hence the Department of Education is created. It's worked out really well for us. I don't know why you'd do something like that. Our test scores are up. American kids are competing all around the world. It's worked out wonderfully for us. No sarcasm there at all. So now we're being told that you are going to have to bear the burden for millions of people. 47 million is the number that's being thrown out. 47 million uninsured people. Now, where does that number even come from? To me, that's one of those, I don't know, they just pull out of a hat kind of a number. There are a great number of people that choose not to have health care. There are a great number of immigrants who've come over and they haven't chosen to have health care either. There's a lot of problems with that number. So what we're talking about effectively is access to health care. That's what they're saying is a right. That's the part that they're talking about to be a right, that everyone should have access to health care. I would challenge any of you, if something happened to you today, to find out if an ER would not take you. Every single ER in the United States will take you for care. In fact, you're already picking up the tab for that. For millions of people walking into ERs every single day, that tab is being picked up. So to pretend, and I do use the word pretend, to pretend that there's someone in the country that doesn't have access to care is not necessarily true. So once again, I want to make sure that we're talking of this in the right context, and that is healthcare is effectively a commodity. It's effectively a good. Now, we all do agree, and we may want to make sure that we're never saying that there aren't things that should be tweaked here. There aren't things that should be reformed, because that's definitely the case. There are a great many things. But government intervention into this situation has not ever been the cure for anything that we've done in this country's history, and it's not going to be the cure this time either. So we're proposing things that are closer to, if you look at the flyer that's been passed around, and that many of you, we passed out thousands, I mean thousands. I know we were doing probably 1,000 an exit, and we were at approximately 20 exits around 275. So some a little bit higher and some a little bit lower. You printed those yourself. We didn't print those. This crowd printed those, so thank you very much. On that flyer, there was a couple things mentioned. One is that, yes, this does need to be addressed. Yes, we agree that healthcare is fundamentally, there's some flaws with our system right now, but we don't agree that government intervention is the key to fixing this. Two of the key points that we talk about as being the most important fixes to this situation are, one, why can't we actually allow insurance to move across state lines and just allow natural competition to take place?